Assalamualaikum and greetings to our academic panel and also my fellow friends. My name is Anis and in this video, I am going to talk about a specialty that I am interested in and I will be explaining about my research and readings regarding this field.
In the busy world of surgeries, where surgeons are in the spotlight, there's actually a team of unsung heroes called as anesthesiologists, and these are the special doctors who do important work to help patients not feel pain during surgery. Therefore, let's explore together the magic of anesthesia and how this anesthesia works on our body to keep the body functioning as normal as in daily basis during surgery. First and foremost, what is anesthesia? Well, it's about maintaining stability of patients' multiple and complex organ systems during surgical operations while we provide freedom from pain. Means that we induce a controlled overdose of drugs that requires continuous intensive care of patients during surgical intervention. Anesthesia started in the early to mid-1840s, and during those times, physicians used anesthetics for painless surgical interventions, where some famous anesthetics being used are the diethyl ether and the laughing gas nitrogen oxide. So in 1846, an American dentist named William Morton claimed to be the first person to successfully use ether as an anesthetic when he extracted the tooth with no pain. And fast forward to today, the development of anesthetics continues as today's anesthesia utilize a variety of inhalation agents, intravenous drugs, and regional techniques for precise and individualized pain management during surgeries. The history of anesthesia remains in a legendary history book called The Genesis of Anesthesia, where it described the interesting professionals and many events that paved the way to the discovery of anesthesia today. And Malaysia too has many of these unsung heroes who serve thousands of patients during surgical interventions, such as Dr. Disan Chitanandan. He is one of the first Malaysians to qualify as an anesthetist, and his story was unraveled in the news Straits Times for the impact he contributed to Malaysia. That's about the history and development of anesthesia. Now let's move on to the real deal of today's topic. And in this video, I would like to highlight that our focus in this topic will be on three essential body systems related to anesthesiology. What are the three systems? They are the nervous system, the circulatory system, and the respiratory system. Talking about nervous system, firstly, the nervous system is actually divided to the central and peripheral nervous system. And to relate with anesthesiology, we are going to focus only on the central nervous system. The central nervous system consists of brain and spinal cord, and it serves as the command center for the body. Neurons, the primary cells of the central nervous system, transmit electrical signals that facilitate communication within the system. So in the brain, these signals known as action potentials facilitate the processing and integration of information, allowing for various cognitive functions of and bodily responses, including movement, sensation, and higher cognitive processes. Now, during surgery, doctors use anesthetics to induce control unconsciousness. So, these anesthetics will modulate the neurotransmitters receptors in reducing the nerve cell activity. So, when anesthetics are administered, they actually interact with neurons in the central nervous system, and this interruption in the neuronal signaling is what allows medical procedures to be performed with minimal discomfort or awareness for the patient. So actually on a molecular level, the anesthetics influence the balance of excitatory and inhibitory neurotransmitters in the brain. So it works by enhancing the GABA's inhibitory effects and depress excitatory neurotransmitters like glutamate. So in simple understanding, these excitatory neurons release excitatory neurotransmitters that generate action potential, while inhibitory neurons release inhibitory neurotransmitters like GABA, which is responsible for counterbalancing the generation of action potential. So in surgery, the anesthetics that are administered will cause the inhibitory effects to increase, while the excitatory effect will decrease, and more hyperpolarization than depolarization, and this is what leads to anesthesia conditions. Moving on to the circulatory system, which consists of heart, the blood vessels, the arteries, veins, and capillaries, and the blood itself. The function of the circulatory system is to transport the blood throughout the body's tissues. It works like the body's delivery system, ensuring oxygen and nutrient reach their destinations. So in its normal state, the circulatory system is a finely tuned orchestra with the heart pumping the oxygenated blood to the body's tissues and returning the oxygenated blood for oxygenation. So the cardiovascular system consists of two main lobes, systemic circulation and pulmonary circulations. The pulmonary circulation allows for the oxygenation of the blood, and systemic circulation provides for oxygenated blood and nutrients to reach the rest of the body. In surgery, anesthesiologists will closely monitor and regulate the circulatory system. Anesthetics are employed to maintain parameters like heart rate, blood pressure, and cardiac output within safe limits. So anesthetics can influence the cardiovascular system by altering the heart sensitivity to neurotransmitters like norepinephrine. And it is also an example of excitatory neurotransmitters. So two classifications of anesthetics that modulate the cardiovascular systems are the general anesthetics and local anesthetics. These modulations affects heart rate and contractility, requiring careful management during surgery. Last but not least, the respiratory system, which involves the airways, lungs, and associated muscle. Its function is to facilitate the exchange of oxygen and carbon dioxide between the body and the external environment. Specifically, the respiratory system has two portions, the conducting portion and the respiratory portion. So the gas exchange occurs in the respiratory portion in the lungs, where oxygen from inhaled air diffuses across the thin alveolar membranes into the bloodstream, binding to hemoglobin in the red blood cells. Simultaneously, the carbon dioxide, a waste product, diffuses from the blood into the alveoli to be exhaled during respiration. So during the surgical setting, anesthesiologists will guide a patient's breathing rate and depth, ensuring adequate oxygen supply and efficient carbon dioxide elimination. And usually, they will use the mechanical ventilation as a breath support during anesthesia. So certain anesthetics, especially those impacting the central nervous system, can depress the respiratory center in the brain and increase inhibition, leading to decrease in responsiveness of the respiratory system to the stimuli. So this depression results in reduced responsiveness to elevate carbon dioxide levels, reducing the respiratory rate and tidal volume. So, anesthesiologists will monitor and adjust ventilation to maintain optimal oxygenation and carbon dioxide elimination. In surgical interventions, each surgery has their own complications and preventive actions. So let us focus on one example resulted from respiratory system complication, which is the obstructive sleep apnea, the OSA. So OSA brings specific concern when it comes to anesthesia, as patients with this condition face a higher risk of breathing issues during surgery. So it is marked by repeated airway collapse during sleep and demands a careful review into the patient's medical history before any procedure. So during surgery, the vital signs are closely monitored using pulse oximeter and capnography to track oxygen levels and carbon dioxide. So to lower the chance of breathing problems, the anesthesiologist will adjust the anesthetic titration carefully and adapt with different airway management based on patient's need. Post-operatively, continued monitoring is important as for the continuous positive airway pressure, the CPAP therapy.
In summary, I have mentioned about the three essential systems in anesthesiology: the central nervous system, the circulatory system, and the respiratory system. Then I have given an example of complication, which is the obstructive sleep apnea, as well as its preventive action. So as we've glimpsed into this study of specialty, we appreciate the skillful role anesthesiologists play in balancing all body systems, ensuring comfortable surgical experience for the patients. So thank you for your time, and may this knowledge deepen our respect for the dedicated professionals who skillfully navigate the balance between life and surgery.